chat. We're going to record so that we can share. Put those in the chat, and I think this will go about 30 minutes or so, maybe less, and then some opportunity to talk and address questions afterwards. With that, Hannah, please take it away.
I have you guys connect. Sorry, I wanted you guys to see, to bring up video because I'm using my work computer and it doesn't have video on it, but it backfired on me. Can you guys hear me?
Can hear you beautifully.
Okay. Good morning. Good morning, people. My name is Anna. I am a nurse practitioner providing psychiatric services at multiple clinics around Hopkins. So I provide psychiatric services at the Harriet Lane Clinic, at the Bartlett Clinic. I go to quite a few of the county clinics. I go to Hartford, Howard, Anne Arundel. I'm probably forgetting one, but I am stretched out across a multitude of clinics around the Baltimore area. And so today we're going to be, like Allison said, talking about how to combat provider stress and burnout. I want to get rid of. All right. Can you guys see the presentation okay?
Yes, we see.
Yes.
All right, perfect. What a year we've had is all I can say to start out. But thank goodness we're almost done with it. And of course, hoping for a brighter 2021. As I said, today we'll be talking about provider stress and burnout, especially during the pandemic right now where things are extremely difficult. Although it says provider stress, we'll just discuss it in general healthcare workforce with some specific data to providers. Our objectives today, we're going to do an overview of burnout in the healthcare profession, and then look at some causes of burnout, move on to review the signs and symptoms as we look at how these can affect the workplace. We'll look at some assessment tools for burnout, and then we'll go a little bit more in detail on the most commonly used one, and then look at some of the implications of burnout within and outside of work, especially with the pandemic right now. And then we'll examine some ways to combat burnout, both on a personal level and on an organizational level. And then finally, we'll look at a ton of available resources for our Johns Hopkins medicine staff, as well as resources that are available outside of Johns Hopkins. So the term burnout was first really described in 1974 by a psychologist named Herbert Freudenberger. I think that's how you say his name. He would volunteer at a free clinic in New York City. It was sort of a drug-ridden clinic at the time. And over time, he saw that the clinic staff would present emotionally depleted as well as with other symptoms. As the staff continued to present with these symptoms, some of them included fatigue, frustration, all around just being all around inefficacies at work due to excessive demands on their energy, their strength. Over time, with these symptoms that they were presenting with, he called the phenomenon burnout. His work was then further studied and expanded upon by a social psychologist by the name Christina Maslach. She later developed a model for burnout, which we'll go over later. From that, as I said, we're going to go over this a little bit quite in detail later. So why are we even talking about burnout? Again, it results in a lot of medical errors when it comes to our profession. The quality of care that's being provided when people are burned out is much lower. There are a lot of costs that have to, that when people are burned out that are associated with it. Overall outcomes are much worse when people are burned out. The impact of burnout on healthcare workforce has been so substantial, between staff being out sick, leaving, and the need to hire new staff members. I think I saw a number in the Sorry, Epic is, sorry about that. I think I saw a number in the ballpark of 300 million in lost productivity every year. I mean, it's a systemic problem, and not just an individual problem. If we're talking about 300 million being lost each year, and now with the pandemic, there's even more reason for there to be concern all around the country, given the already heightened shortage of staff to provide care for patients. So when I looked at literature to compare what burnout looked like before the pandemic happened, the numbers varied a little bit, but the general consensus of most surveys and reviews was that there's an increased rate of burnout in healthcare in the last decade. A prime example was the Medscape annual report in 2017 that showed physician burnout rate back in 2015 to be at 46%. But the same survey had been done in 2013, and the number was 15% less. So overall, burnout rates have doubled in healthcare workers, and this occurrence, if you're looking at just healthcare, the rates have doubled in the last decade, and that number, given that it's doubled, it's even twice more than that of the general U.S. working population. And then when just looking at healthcare professionals in general, that the rate was at approximately 40% of healthcare workers reporting that they've experienced some type of burnout. And then when I was looking at these numbers, there was a lot of focus on physicians, as you can tell by the previous example, but there was quite a bit on nurses and medical students as well. Even when I looked at literature reviews from outside of the U.S., their focus was still just on physicians and nurses. We know, that our clinic, for example, thrives because of different roles we have, and how vital those different roles are. Although there wasn't much data on specific rates of burnout in these various roles, like social work, case management, just to name a few, there is highlight of them being at increased rate of burnout as well, especially due to the added responsibilities of things like tracking outcomes, data entry, going out of their way to do for our patients on top of their already overwhelming caseloads. And so going back to general numbers, in 2018, a Medscape survey listed different specialties at most risk for burnout. They named emergency medicine, general medicine, and family medicine as having the greatest risk of burnout. Let me just skip to the next slide real quick so you can look at this. So this chart actually shows some of the burnout rates by department and their rates of burnout. So if you look in the middle, right here, where is it? Right here, we see infectious disease, which is our area, at least for me, my area of focus. And they're right there at 40% with a lot of these specialties that were named. For example, something like neurology was named up there at the highest, critical care up there at a high rate at 48%, and then you have infectious disease down here right at 40%, along with a lot of, and then thinking about some of our providers, we have pediatrics right here at an extremely high rate. Let me go back. In terms of general burnout numbers before COVID, the healthcare profession as a whole, they reported a range, and that's not looking at just physicians or just nurses. So everybody put together at a range, I mentioned earlier that the range varied. So it was between 30% and 70%. And that's quite a huge range. And I know the bulk of it falls in the middle of that, between at the 50% mark with the physicians added and nurses added to that. The American Journal of Medicine in 2018 reported on a survey of 1,500 US physicians and found that 42% of them had experienced some sort of burnout symptoms. The same survey was done in 2019, and that's just a year later, and that percentage had gone up to 44%. And in that same survey, there was a surprising 14% of those physicians reporting suicidal thoughts at some point. And I know these are a lot of numbers. And in 2019, the National Academy of Medicine released a report showing that an average of 60% of medical students and residents experience burnout. That's, and I think that's one of the big numbers that I saw in terms of the rates in one specific group of people. The rates in nurses varied between, percentages in the 30s and percentages in the 40s. One study actually said that a racking 27% of nurses will leave nursing altogether because of burnout. It's clear that it's been problematic, but the pandemic came and only made things worse, as you can imagine. I know the focus should be on US and the burnout rates in the US, but I just want to bring your attention to a survey from the National Institute of Health. They did a survey in 60 different countries around the world and found that more than half of those countries, so 33% of them, in half of the people in the survey, half of those in healthcare reported burnout during the pandemic. And, this sounds like a number that I'm harping on, but more than half of, think about our clinic. If you're thinking about a small clinic like ours, and you think about half of us reporting burnout, and then at that half, a risk of 27% of people wanting to leave the profession, leave healthcare altogether because of burnout, that you have to think about that $300 million in each year being spent in trying to replace staff and other things. And then the U.S., again, like I said, these numbers are double in healthcare, but in just looking at that survey, the U.S. rates were much higher than other countries. Something compared to like Italy, our U.S. U.S. rates of burnout was much, much higher than Italy, India. I can't remember the other countries that were listed on there as they're being higher, but I know Italy was named as one of the ones that U.S. was significantly higher than. Even looking outside of healthcare professionals, there was this, San Diego University and Florida State University did a study, and that's where that 70% comes in, and a whopping 70% of just Americans altogether during this pandemic felt some sort of mental distress because of COVID-19. If we're thinking about 70% of the general population, what is to be said about healthcare workers, the ones who are at the front line, and again, being a population that's at most risk for burnout. As you can see, a lot of information on trends that indicate worsening of stress and burnout given how things are going. In a lot of assessments, people are seen to be reporting burnout these days at almost the, if you're rating it at a 0 to 10, 10 being the worst they could feel, people are going at almost maximum. You see these scores of people saying during the pandemic, on a scale of 0 to 10, my stress has increased from 3 to 8. It's only projected to worsen and have severe consequences if we don't have measures put in place to take care of things. We've already seen shortages in healthcare, staff members leaving positions because of burnout, and that's only to get worse with the pandemic not slowing down. I don't know if Maryland has gone back to phase 1 yet, but things aren't slowing down. There's a concern, of burnout having this mental, physical, lasting effects on us. There's even been mention of this phenomenon called a parallel pandemic, where they're estimating 25 to 40% of frontline workers being projected to suffer from some sort of post-traumatic stress disorder because of the repeated stress they are having to go through and all the trauma they're experiencing of all the things that they're seeing with people coming into the hospital and them providing care for patients. I don't think we need to be thinking about the effects of it in the future. It's already happening. It's already been happening since April. We can't talk about the lasting effects of what burnout will we can't talk about the lasting effects of it in terms of later on, when we already saw Dr. Lorna Breen, the medical director of the ER at the New York the New York Presbyterian Hospital back in April who committed suicide. So it's not a thing of, oh, what things will look like in the future. Things already look pretty grim right now. And so even before the pandemic, healthcare workers, of course, were known to be working in the most stressful environments. But apart from work circumstances worsening your risk for burnout, there can also be personal factors that play a role. I'm thinking about just reasons that could have worsened this risk with COVID, even before looking at this list that's up here. Think about the people who are having to work under intense stress levels. They were having to work in like makeshift settings. I'm thinking back to how things were going when ICUs were overrun and we were having to change different units into COVID units, and what those staff members had to deal with. And I know the fear of not having enough protective equipment when things, looking back in April, I know that had to be quite stressful, needing to cover additional shifts to either compensate for people who couldn't make it to work or whatever limitation, for whatever reason, the quarantine left them out of work. Think about how often you guys had to quickly adjust to things out of your regular work day, all the new policies and procedures that we're still trying to figure out how to work with, the long hours, and that's just at work. We haven't even touched on having to deal with life outside of work. I know the thought of, I said this a lot during maybe like around the May time, June time, that my patients were falling apart, and that has its own effects on staff. And then there's the fear of just your health and the health of those around you. This list goes on. And this list on the right here is, the list on the right is just so happened for some of the causes of burnout to be in this order because of how the survey was conducted. Although the factors of burnout can be both situational and individual, like I've mentioned, there's a lot more evidence on how organizations as a whole contribute to burnout. Most research named the most common, and this is the list on the left right here. One, to be too many bureaucratic tasks and just increasing use of computer practice, all the required documentations for encounters for patients with limits, which limits the amount of time you actually get to spend with patients. It's either you spend time with your patient and take work home or be behind in charting, or you don't give them the time that they needed. And then you just building onto that, the amount of time being spent at work, there simply just isn't enough hours in a day for us to do what we need to do for our patients, and then get caught up on all of the tasks that need to be completed. And a lot of the literature about time was really more focused on the time being spent doing non-clinical tasks. And then the work overload, inconsiderable amount of work that just doesn't allow for you to actually do your job at hand. You get no time, it leads to things like you getting no time to rest and actually restore your energy. Some of the reasons, the second bullet point, so these are some of the reasons that didn't really come up as readily as others, but as you can see, they're just as pertinent. The lack of support from higher ups, cases where supervisors are only worried about their administrative responsibilities, the lack of conflict resolution training, then the lack of awareness. This was a big one. Whether this be in relation to not knowing what resources are available to staff experiencing any type of problem, or what burnout actually looks like. Ultimately, when you're unaware, there's usually a culture of people not wanting to talk about problems. Either they worry about being judged, or plenty of other reasons. And then this one, the poor coordination was, I don't know, I didn't quite think about it, but as I read through it, I was like, oh, that makes absolute perfect sense. I'm just thinking about not having proper resources, not having the proper way to make referrals so that whatever plan of care you're putting into place is actually seen through and the patients get the help that they need. And as you're looking at these individual factors listed The individual factors listed below in the third bullet point, they increase your risk just as badly as the top two reasons, but there are things that we don't often think about as causes of, or that we wouldn't think about as causes of burnout. You know, when you get into a role and you sort of say, I'm gonna do my best, and you start to hold yourself to a higher than normal standard. So you take on responsibilities that may not even be yours and carry the weight of your peers on your shoulders. There's the guilt of not being able to really help patients the way we want to. There are lots of limitations, lots of things that prevent us from doing for patients like we really would want to. And then this lack of boundaries. So not only with patients, but between your work and personal responsibilities. These are the folks who take their work home. And not to say that there's anything wrong with taking work home. It's when you start to do it repeatedly, and you're not getting to spend a lot of your free time doing things that you enjoy. You're spending all that time catching up. There's also just worry about outside responsibilities. I know I'm talking a lot about things that happen at work, and we haven't even touched on, you know, when I leave work, what does my household in terms of my responsibilities look like? My financial responsibility, taking care of family members and all that stuff. And then there was a big thing in terms of personal individual reasons, being any pre-existing physical or mental health issues. It's poor health will lead to burnout, and burnout will lead to poor health. And then in this next slide, you know, before we go into the signs and into the symptoms of burnout, to simply put it, burnout, it'll show up when you're exhausted because of excessive or stress that's prolonged. Being in a state of prolonged stress, as we all know, has a lot of negative consequences on your health. A lot of negative consequences on your health, and poor health, as I said, on the other hand, leads to burnout. It just becomes this never-ending cycle. And so when you're looking at the symptoms of burnout, it's easier to look at them through these different dimensions, especially because of Christina Maslach, that I mentioned earlier, that took Dr. Frutenberger's work and expanded it. She came up with the assessment tool, and her assessment tool is one of the ones that's mostly used. And you know, the way she did, she broke the symptoms into dimensions. There's the individual, interpersonal, and self-efficacy dimensions. In the individual one, you're experiencing emotional exhaustion due to the depletion of personal resources and energy. These people will experience, the people who experience burnout in this dimension, they have poor coping skills, and they have these non-specific physical complaints, and they may have a lot of GI symptoms. In the interpersonal dimension, there's depersonalization. People may be withdrawn to deal with whatever work demands they have. Over time, it leads to them just having these uncaring feelings towards their work, their peers, and even their patients. At times, they tend to not be as sympathetic to the patients as, or sympathetic or empathetic to the patients as they would have been previously or should be. In the self-efficacy dimension, there's diminished personal accomplishments. So feeling like you're not accomplishing much despite all of the work that you're putting in. And this can lead to poor motivation, and even your sense of creativity will decrease. And so awareness of these dimensions and how staff may present in each is important, because symptoms typically overlap. Those are depression. It's hard to talk about burnout without mentioning depressive symptoms. As you can see, when I pull up to the next picture, to the next slide, you can see how many of the symptoms overlap. Hold on. You can see how many of the symptoms overlap. There's been a lot of research that mentioned or questioned whether burnout was just a new package for an old problem, i.e. depression. We'll actually look at some mental health issues that worsen or may surface because of burnout. But before that, I wanted to just show you some visuals on the symptoms of burnout. So this slide, to the left, this one to the left, oh geez, that's to the left right here, right there. It does a good job of showing how it starts out as a minor problem where you're just, I don't have any energy, my attention span is decreased, and goes as far as people underperform and goes to the point of underperforming, just disappointment, being emotionally distant. And then to the right here, the symptoms are actually broken into physical, emotional, and behavioral symptoms. Some like the sleep problems, weight gain, loss of motivation, frustration can also be, of course, symptoms of depression. And then this picture right here is a good visual of why burnout may have been looked at as the new term for an old condition. Just look at how much depressive symptoms and the symptoms of burnout overlap. Like, you see depression here has symptoms of just your regular tiredness, your regular stress, and then you have burnout down here that has all of the symptoms of depression in there. And then this one was probably my favorite slide because it's probably the best illustration of what burnout looks like. You start out by just looking frazzled, right? Extremely stressed out, and then to the point of you just don't even have the energy to show up anymore. And so assessing burnout can be hard since these symptoms are so subjective, but this Maslow, these were some of the tools that, as I was looking at them, some of the ones that had been touched on, some literature had used some of the tools. And so the first one there that was released in 2002 and it does any occupational group. So I don't know that it would be the best one for healthcare because it just covers a range of things. And then there's a single item burnout measure, which kind of speaks for itself. There's I'm probably going to butcher this name, Sharon Malamed burnout measure, and this one focuses on just exhaustion, but three different aspects of it. So the physical exhaustion, emotional exhaustion, and cognitive weariness. And then there's the Copenhagen Burnout Inventory, released a few years after the Oldenburg one. It differentiates between physical and psychological exhaustion. And as you can tell, a lot of them are focusing on exhaustion. And then there's the Birkin Burnout Inventory that looks at, this one's closer to the Maslow Burnout Inventory. This one looks at 3 different dimensions of burnout as well. And then there's the important one, the Maslow one, which has been around since 1981. It's the most commonly used tool. And the reason it's more common for us healthcare professionals is because it's specific to those who work in human services and medical professionals. And of course, like I said, it covers 3 different dimensions of burnout. And so this is the tool right here. You might not be able to see it. I'll move to the next slide where you can see more of the questions. So it has 3 different sections, like we said: the emotional exhaustion, personalization, and self-efficacy. In each section measures its own dimension of burnout. This means that the score in, for example, the emotional exhaustion part doesn't necessarily have to align with that of personal accomplishment. There are 22 questions. There are 22 questions on the tool. 9 of them are under the emotional exhaustion, 5 for depersonalization, and 8 for personal accomplishment. And then usually when looking at the scores, high numbers under the emotional exhaustion and depersonalization sections, and low numbers, of course, in the personal or accomplishment section may indicate burnout. And then these are just a close-up of the questions. I'll leave it up for a little bit just so you can look at it. When I looked at this, a few of them I was just like, oh, I feel that way. And a lot of times we don't really acknowledge, it's not like we're suppressing, but you don't really think about these things until you start to look at these tools and you realize, well, okay, maybe I need to take a step back. Because all these or a few of these things I feel or may feel this way. And then at the top right over there is the sort of the scoring guide. And this scoring guide it's not like it's so, oh, you can only use this one. It varies a little bit. I wanted to leave this up just for a little bit so you guys can look at it. I'll move it in 5 seconds. Okay. And so in this next, now, it's not that we haven't mentioned some of these, but just to reiterate some of the things that have contributed in worsening burnout right now, with the pandemic in place. And that's thinking from March or April to now. We've seen surges in care demand. So while clinics are capacities are lower, the need for care is higher. Infection rates are spiking, and thus increasing the risk of infection. There's much more time being spent at work to meet these surging demands. Equipment challenges, whether that be personal protective equipment or other things, physical isolation. With working from home, I didn't appreciate something as simple as waking up every morning and having to leave the house and go somewhere until I've had to be home, waking up, coming down to my to sit in the same area and sit on the computer. I know some of us have made the joke of I've had to get pillows to sit on because I'm spending so much time just sitting in front of the computer. There's so many new guidelines and policies, and the things, they're changing every day. The bigger issue, which we've touched on, is worsening of existing mental health conditions or new concerns. Okay. And so I made mention of depression and burnout overlapping in symptoms. I want to quickly touch on the difference between the two. Burnout, for one, isn't recognized by the DSM-5 diagnostic criteria that's used to diagnose other mental health conditions. The symptoms of burnout are primarily work-related for most people. Once they leave work or aren't doing work-related things, their symptoms aren't as bad. And, in terms of depression, the negative thoughts and feelings that come with depression are typically in all areas of life, not just work-related. This is not to say that someone experiencing burnout at work doesn't have symptoms at home, because we've talked about causes of burnout being both individual and situational. And of course, treatment routes are different, although there are similarities. Treating burnout, usually you're focusing on changing work-related conditions. So telling someone who's depressed to take time off work to recharge it's just not going to work and may actually worsen their mental health. Now, the reason I labeled this slide with the ... is because burnout, mental health, and the pandemic, if I could have done a clip art, I would have just drawn arrows around those three things, going from one to the other. As you can imagine, symptoms of anxiety and depression increased considerably in the US since April compared to the same time last year. I saw a study that's in 2019, the National Health Interview Survey showed about 11% of the survey participants reporting symptoms of depression and anxiety. But in 2020, that number went from 11% to 40% or 41% pretty much of participants in a representative panel survey by the CDC reporting at least one adverse mental or behavioral health condition, including symptoms of anxiety disorder or depression, trauma related to the pandemic, and having started or increased their substance use to cope with stress and emotions that come with COVID. The percentage of respondents who reported having seriously considered suicide in the 2020 survey within 30 days of completing the survey was 10%. That's quite a number. I don't remember exactly how many people were surveyed, but going from 11% to 40% and then 10% of those people reporting suicidal ideations is a pretty significant number. And then to look at those numbers and specify them to healthcare workers, it's a lot higher. There are 20 of looking at the general population, 10.7% of them say they've had suicidal ideation. But then when you come to essential workers like healthcare workers, 21.7% of them say that they've had these suicidal ideations. And so we're talking about risk per risk for burnout and per population, and the fact that in healthcare our risk for burnout is double. This number just proves that point. We have to work harder to we have to work harder now at keeping afloat because there are a lot of odds stacked against us. We're talking about work stress and I haven't even talked about what other stresses people, like again, I keep saying haven't talked about other stresses that people are dealing with outside of work in their homes, with families and all that. But anyway, the point of this was to talk about how to combat this stress and burnout. Efforts have to be both individual and organizational because, again, the issue is multifactorial. There's so much information on there was an incredible amount of information on ways to combat burnout. One of the main ones revolved around awareness. And this is awareness, again, in all staff members, whether personally knowing what to look for and when to take a step back to recharge, managers and administrators knowing what to look for and when to step in, or just how to even prevent it from really becoming a problem. Involving leadership, greater leadership qualities increase, of course, job satisfaction. We know this. Acknowledging of burnout as a systemic problem. So, and if those people in the administrative roles and the manager roles and acknowledge that it's a systemic problem, this promotes a culture of self-care. Incentives are always great, encouraging a work-life balance, peer support, so just taking time away from all this documentation that we are required to do, having group discussions, check-ins, addressing the problem early, so having that open communication and saying, we encourage for you to take time off, and all those things are absolutely imperative to combat it. And then there was a lot of focus on basic needs, and these might sound really redundant, but really important. Keeping a schedule is extremely important. Adequate sleep, exercise, healthy diet, taking breaks at work, even if it's just, let me get a coffee break, let me stand up, stretch my legs. Doing things that you enjoy during non-work hours, open communication, as I mentioned, practicing coping skills and stress management. And then the big one is providing resources for staff members. And so this is the one that we're going to focus on in a few minutes. And so just the previous slide is, of course, just general ways to combat stress and burnout. But during the pandemic, all of the previous mentioned statements, of course, apply. But during the pandemic, where everything seems to be so chaotic, there's more, a lot of people looking to leadership for guidance. So strong leadership is absolutely important. Taking charge when needed is important. Calmness and being decisive, given the overflow of information that we're all getting right now. Being transparent and effective with communication. Focusing on teamwork. So that may look like splitting things up and not having one person do the same thing over and over. Showing compassion. You never know what someone's battling outside of work in such a climate. And then rotating staff and offering time off. We've spoken about the awareness of resources for staff and fostering an environment where staff members can seek help openly. And so moving on to the resources. So with COVID, the existing resources have been expanded quite a bit. There are lots of different services based on which Hopkins entity you work at. And of course, there are lots of ways to get to it. The easiest, I wanted to put this slide up and put these websites just to show you the easiest ways to get to it, right? So I can click through and show you guys exactly what, how to reach them if you want to do it that way. Nay.
I think why not? Let's not do that. Let's want to make finish through, and then maybe if people want to go back and click through, let's do it at the end. Is that fair?
Oh, yes. So once you click, you get into this website, right? At the top right, there's a health and well-being link that you go to, and it gives you plenty of options on how to get help. So you can either send an email to this email, and they'll send you to the right, or guide you to the right direction of what you're looking for. There's a tab. You know what? Let me go in there so I can show you exactly what I'm talking about. But when you click on a tab that directly, in that website, out and right next to the email, there's a tab that directly takes you into these online resources. And under there, there's spiritual, mental, and emotional support. That link takes you now to more of the resources that I'm talking about. And then there's also an option, they're all right next to each other. There's also an option for this flyer right here that gives you, this one I will click on hold on, because the next slide is, that flyer has all of these resources on there. Okay, so I'm gonna click on the flyer so that I can actually show you what it looks like. Make it just a little bit bigger. Okay, so once you do all the clicking that I was mentioning earlier, you get into this flyer that goes over all of the resources that you potentially can access at Hopkins. And most of these are available at the main campus, Bayview, All Children's Hospital, and Howard County General Hospital. So the first one here is My Support, and they provide emotional support, daily life assistance. They'll even give you referrals for child and elder care, as well as legal and financial assistance. They're available 24/7, and depending on which entity you are, they have different numbers to access them. And then there's the next one down here, which is the RISE, Resilience in Stressful Events. Resilience in Stressful Events team. They provide confidential peer-to-peer support for employees who have experienced any stressful patient-related incidents, and they're available 24/7. The numbers are right there on the side. There is spiritual care. There's spiritual care, and then there's Healthy at Hopkins, which provides resources and programs that cover any spectrum of healthy lifestyle strategies, sleep, meditation, relaxation. And then the important one is there's the Department of Psychiatry here. They provide assessments and management of mental health illnesses. They even have a clinical on-site team. And then, let me go back to the...
And I think people are saying they cannot see the resources. So I think maybe it's open on another, it's not what you're clicking.
Oh gosh, I'm so sorry. I'm sorry. Okay. It may have opened somewhere else.
Yeah. And while you're looking through that, there's been a couple questions about resources out beyond Hopkins.
Okay.
You're going to address as well.
So I can, leave me your email and I'll email you the flyer that has all of the resources I was just talking about. I can email it to you. But outside of Hopkins, we have right there. There's the Calm app, and I don't know if you guys have seen the commercials come on TV quite a bit. You can get it with working at Hopkins. You can get free subscription. All you have to do is just download the app, put in your Hopkins email and password, and you're right in there. And it provides meditation for better sleep, lower stress, various different things. And then I just learned that the Peloton app gives you a 30-day free trial, and it's not just cycling. So you can stream running, strength training, exercises, yoga, and even meditation classes. As I was looking through things, quite a few that aren't, apps or around here came up. And there's this Project Parachute that started as a local movement in North Carolina and now has over 500 volunteer therapists in 37 different states, all offering pro bono therapy sessions to frontline workers. No questions asked, about why you need help. Just have to be a frontline worker. There's Headspace, which is another app. It added a free COVID resource called Weathering the Storm, and it has a lot of meditation, sleep support, and movement exercises. And then for frontline workers, there's a crisis texting service developed by Aetna and CVS Health, and they offer free help to caregivers if they text this number here, this 74174 number. And once they receive your text, you're immediately connected to somebody. Those are my references.
Fantastic. There have been a few questions in the chat. Thanks, Anna. That was really, really great. I think, I think particularly highlighting that oftentimes we don't even recognize what we're feeling as burnout.
Right.
And I think it's quite appropriate. This is the first talk because we every day we're traumatized by the changes we see with more red, with the COVID rates, right?
Yeah.
And even engaging in social media, et cetera, is increasing our anxiety and our burnout. So thank you for doing this.
No.
I just want to give people an opportunity. There were a few questions in the chat that came through. Want to make sure those were addressed. So I think definitely there were questions about resources beyond Hopkins, which I think you did address. And I wanted to add that the Calm app is for Hopkins, yes, but I think they do have access to the basic level, even just for anybody, to at least access limited stream of their meditations and things like that.
Absolutely. You might get shorter meditations, but
yes.
If you're a beginner, 2 minutes is probably better than than doing a 15-minute meditation session.
Were there other questions that people had that come through? There was a question about sharing the slides, and yes, we will share.
Yes. Oh, so what I can do is when we share the slides, I can just give you guys I can attach the printable sheet that has all of these, hold on, let me go back here. That has all of these on there with the numbers that you can call. And then I didn't highlight this down here. There's a 3 times a week Zoom meeting for stress management and mindfulness session, Monday through Fridays, 8 a.m., noon, and 5 p.m. religiously. Whether somebody is on there or not, they log on, just waiting for people to log in.
Oh, wow. And is that available for anybody or just to Hopkins people?
Nope, anybody. You just have the meeting ID right there and you log in and you're in, not just Hopkins people.
That's fantastic.
Yeah.
All right. Any questions so far?
Don't be shy.
Yes. And didn't boast yourself. She's fantastic and has been great for our patients. And I think for us too, as a staff member, to really appreciate that.
Thank you.
Great.
Thank you.
Yes, go ahead.
Sorry, I had a question. I put it in the chat to whether or not the Calm app works with your Hopkins information.
Yes, it does.
Thank you.
No problem.
I can attest. I just logged on myself for the first time and meditated. So I don't know if anybody else has experiences with the app, but it's fantastic.
I had done the free trial before, but it doesn't go beyond the meditation. Are you able to hear like the reading to you?
Yes, yeah. So once you put in your Hopkins information, you have access to everything on the app.
Great.
And it's music, that's sleep music, wake music, anxiety music, stress, lectures, blog. I mean, it's everything. It's full access. So, all right. And that was fantastic. Thank you so much for being our inaugural webinar person. Really, that was really amazing, and we'll make those available. If there's no other questions, please feel free. Some people may be shy, so do email them to us either through Dorcas or just directly to us, and we'll connect Anna back to you. Thanks for spending your lunch with us, and we do hope that you were able to use this.
Thank you guys. I appreciate your attendance.
Awesome. All right, bye everybody.